Welcome once again, dear students, in the video lecture series of first aid related with wounds and injuries. This is the third lecture and it is in continuation with the second one. In today's class, we shall discuss amputation, crush injuries and shock. Let's begin with amputation. So, amputation means removal of limb or a part of limb. And the good thing about amputation is that the reattachment of amputated limbs, fingers, or toes is possible nowadays if the injured and the amputated part arrive at the hospital as soon as possible. Let's see first aid in case of an amputation. So the first point is that control the bleeding by providing direct pressure to the wound. So bleeding should be stopped immediately and it should be stopped as early as possible. We have discussed this point earlier as well. And then put a clean cotton bandage on the wound. Now place the amputated part in a clean plastic bag. So the amputated part must be collected in a clean plastic bag. If possible, place the packed amputated part in a container of ice. But the important thing is that do not put ice directly on the amputated part. Actually, amputated part is a biological tissue, and if this tissue comes in direct contact of ice, then the tissue may get damaged because of cold shock. That's why it is advisable that the amputated part must not be in direct contact of ice. Now, the embodied part should always be packed in a clean plastic bag. The bag should be free from dust or any kind of other things. Do not put liquids or antiseptic products on the amputated part. Now, mark the package clearly with the casualty's name and the time the amputation occurred. Actually, this is done because doctors can assess the possible consequences because of the delay in time for the reattachment of the amputated part. So this is important to mark the name of the casualty and time of amputation. Now arrange urgent transport of the casualty and the amputated part to the nearest hospitals. So this must be done as early as possible. And after doing all these things, the caretaker must wash his hands. He or she should use soap and water to wash their hands. If soap is not available, then you can use as to wash your hands. Alcohol-based sanitizers can also be used. Here you can see a note. Always urgently transport the casualty suffering an amputated injury to the nearest healthcare facility. If the amputated part has been recovered, do not forget to send it together with the casualty. Okay. So after that, the next topic is this crush injuries. The crush injuries may occur because of traffic accidents, building site accidents, explosions, and natural disasters. For example, landslide and earthquakes. So, crush injuries may include fractures, bleedings, and swellings. Let's see first aid measures in case of a crush injury. The first point is try to keep the head of the victim as low as possible. So, the head of the victim should be as low as possible. Why? Because blood flow may increases in this situation. So because of lowering of the head of the victim, the blood flow in the head can be increased, and this may prevent from the patient from unconsciousness. Now monitor the respiration and consciousness of the victim. If the victim stops breathing, start CPR. CPR stands for cardiopulmonary resuscitation. We have already discussed this. This is an emergency procedure in which chest compression is performed and sometimes it is followed by artificial ventilation. Now, arranged urgent transport to the nearest healthcare facility or hospital. And after taking care of patient, wash your hands using soap and water. If soap is not available, then you can use as alcohol-based heaters can also be used. Here you can also see a note. Always urgently transport a casualty suffering crush injuries to the nearest healthcare facility. So after that, now our next topic is the next and last topic is shock. So shock is a critical condition characterized by sudden drop in blood flow throughout the body. Actually, it is a life-threatening situation, and this occurs when the circulatory system of a person fails. And when circulatory system fails, it may result as vital organs such as the heart, brain, and liver, and many more are deprived of oxygen. Means that these organs do not get oxygen. So it requires emergency treatment to prevent permanent organ damage and death. Now, shock can be made worse by fear and pain. So fear and pain indirectly favors the shock. It increases the shock. Whenever there is a risk of shock developing, reassuring the casualty, making him comfortable and keeping him warm. So if you see in a person a chance of shock development, then let the casualty in comfortable position. You should make certain conditions that the casualty feel comfortable and keep him warm as early as possible. And this may be sufficient to prevent him from deteriorating. Now, see the causes of shock. So, as you can see, there are two very important causes of shock, and there is one more. So, let's see first hypovolemic shock. As the name suggests, hypo means less, volumic means volume, so less volume. So, किसका less volume? Less volume of blood. Blood का less volume कैसे होगा? Because of blood loss. So the most common cause of shock is severe blood loss. So hypovolemic shock is characterized by severe blood loss. It occurs due to severe blood loss. If the if the blood loss exceeded 1.2 liters, it means it is about 1/5 of the normal blood volume in adult, then the shock may happen. The blood loss may be occur due to external or internal bleedings. Now, loss of other body fluids can also result in shock. So, other than blood, the loss of other body fluids can also result in shock. Conditions that cause heavy fluid loss include diarrhea and severe burns. You might have heard about dehydration in case of diarrhea patients. Severe burns also loses body fluids. Next is cardiogenic shock. So as you can see, cardio means related to heart. So in this condition, the heart is unable to pump the blood around. So in cardiogenic shock, the blood is present in adequate amount. There is no loss of blood. The important thing is that the heart is unable to function properly. The heart is unable to pump the blood simply. And this problem may be due to severe heart diseases that might result into an improper functioning of heart. For example, heart attack or acute heart failure. Third one is other causes of shock. So here is a list of other causes of shock, and it includes overwhelming infections, that is called septic shock, lack of certain hormones, low blood sugar level, that is called hypoglycemia, and this is called metabolic shock. Undercooling means body temperature low ho jana, that is called hypothermia. Injuries to the respiratory tract or lungs, and this is called respiratory shock. And severe allergic reactions, that is called anaphylactic shock. Drug overdose or spinal cord injuries, And this condition is called neurogenic shock. Now, what do we see and inquire? Yeah. So you might have observed following symptoms. The symptoms can be divided into two phases. First are called initial symptoms, that is before the development of shock, and the second includes after the development shock. So first see initial symptoms, and this include rapid pulse. It means the pulse increases, pale looks, cold, clammy and sweaty skin. Clammy means wet or sweaty skin. And aftershock, the aftershock symptoms include rapid or swallow breathing. So breathing either increases or slows down. Means breathing becomes abnormal. Cold or clammy skin. So cold, that is cold and wet or sweaty skin. Rapid or weak pulse. So pulse either increases or decreases. It means irregular pulses, abnormal pulses are there. And then dizziness or fainting. Dizziness feel हो सकती है, faint हो सकता है patient. Weakness. The patient may feel weakness. Eye appear to stare. किसी को जैसे कोई stare करता है. So eyes appears like to stare someone. And then anxiety or agitation. Seizures. So seizures are related to brain attack. You might have heard about schizophrenia. So this is so seizures are related with brain. Then confusion or unresponsiveness. The person may be confused. He or she may not be able to take a decision. Unresponsiveness. The person do not responses. Low or no urine output. So the urine output becomes minimum because of profuse sweating. है ना, हमने आप थोड़ी देर पहले आपको डिस्कस किया था कि स्वेटिंग होती है. So because of sweating, the urine output decreases. Bluish lips and fingernails. Fingernails and lips becomes bluish in appearance. Sweating. In fact, profuse sweating occurs. Then nausea and vomiting might occur. So nausea is a stage prior to vomiting. So nausea and vomiting may occur. The casualty might feel thirsty. Now, if profuse sweating occurs, the casualty might feel thirsty. Now, this is very obvious. The casualty might become restless and aggressive. The casualty might complain of chest pain. So all these are post-shock symptoms. Now, what should we do? We can see what are the first aid measures. So the first point is reassure the casualty when conscious. If the casualty is conscious state, then must reassure the casualty. Treat the possible cause of shock that you can detect. For example, as a severe bleeding. Agar severe bleeding ho rahi, if profuse bleeding is going on, then the first thing you have to do is to stop the bleeding. Then lay the casualty comfortably on his back on a blanket or bedding. However, in case of injury of the head, chest or the abdomen, lower the head slightly and turn it towards. Actually, this is called a recovery position. It means lower the head slightly and turn it to a side. We have already discussed this position. In case of vomiting, put the casualty in the recovery position. Okay, so this is position something like recovery, not exactly recovery. And in case of vomiting, put the casualty in recovery position, that is completely recovery position. You may raise and support the legs. Again, by raising the legs, one can increase the flow of blood in the head and then support the legs. However, do not do this when you suspect a fracture or spinal injury. So in case of fracture or spinal injuries, the legs should not be raised or should not be disturbed. Loosen the tight clothing. If the casualty is wearing tight clothes, then the cloth must be loosened. Keep the injured person warm by taking off wet clothing. If the clothing of the casualties become wet, then this wet clothing should be removed and cover him with a blanket or other covering, taking care not to overheat. As you can see a warning, never use hot water bottles or very warm rugs. So warm rugs and hot water bottles are not recommended. Do not rub any part of the body to get warm. बॉडी किसी भी पार्ट को रब नहीं करना है. In case of major injuries, nothing should be given by mouth, as he or she may later need an operation or blood transfusion. So the casualty should not be felt naked. The general principle is never to give blood or sorry, never to give food or drink it to a casualty. So this is a general principle. Important exceptions include hypothermia, but there might be certain exceptions. For example, hypothermia. In case of low body temperature, the hot drinks are allowed. Hypoglycemic shock, when low blood sugar condition हो जाए, in such conditions, the carbohydrate rich food is recommended. Diarrhea. In case of diarrhea, the water is recommended, and fever leading to dehydration, and in case of heat exhaustion or heat stroke, when the person remains conscious. Observe the casualties, consciousness and breathing. So it is important to note down the casualties or injured person's consciousness and breathing. If the casualty loses consciousness, put him in the recovery position again. If the casualty stops breathing, start CPR. We have just discussed CPR. It's an emergency situation in which chest compression is done, and sometimes it is followed by artificial ventilation. Arrange urgent transport to the nearest healthcare facility or hospital. And after taking care of the patient, wash your hands with using soap and water. If soap is not available, then you can use ash to wash your hands. Alcohol-based sanitizer can also be used. And there is a note: always urgently transport a casualty showing shock symptoms to the nearest healthcare facility. So with this, your our first aid related with wounds and injuries is over. Thank you so much.